Ladies, welcome to the Early Pregnancy Information Night. Tonight's presentation will be on body changes during pregnancy, how to look after your pelvic floor and abdominal muscles, how to safely exercise during pregnancy, and minimising common back and pelvic joint problems during pregnancy. There are some common myths about exercise during pregnancy that I'm sure all of us have heard of and makes us believe whether they are true or not. Keeping your heart rate below 140 beats per minute. Now this has been a common myth in the past, but we're starting to change the regulations because everyone's resting heart rate is different, everyone's level of fitness is different, so we tend not to use this anymore. Do not reach your arms above your head. Definitely a myth. It's fine to exercise on your back until you feel dizzy. Again, a myth, and we tend to not recommend this, especially the staff that are involved in looking after you while you're pregnant. It can put them at risk, and we obviously don't want any health problems or fainting if you do spend too long exercising on your back. So we tend to recommend to not exercise on your back, especially in the later stage of pregnancy. You can continue any exercise you have been doing. Again, some may think that if they've been carrying on with their exercise prior to falling pregnant that they can continue, but you will learn later on this evening that there are some restrictions and recommendations that we tend to advise that may lead to some limitations with your exercise routine while you're pregnant. Pregnancy is not a time to commence exercise. Again, keeping active during a pregnancy is important. And I will give you some guidelines this evening on some types of exercise that are safe to commence, but definitely not commencing anything drastic, or if you haven't done any exercise before, then it's probably not the best time to really amp up your exercise regime. Do not use weights. Weights is a very broad term, as we know that they come in different sizes, so light weights are recommended and safe during pregnancy. And again, I'll touch on this a bit later on. So the body is going through quite a lot of change when you are pregnant, and this is a nice diagram to see where a lot of the weight is distributed as your tummy starts to grow, baby gets bigger, and the changes that are happening to your body. In the breast, gaining about 500 to 800 grams. Through the uterus, placenta, the fluid, and the baby, roughly about 5 kilos. Fat, 4 kilos, extracellular fluid, 3 kilos, and a blood volume increase of just over 1 kilo. So obviously you are gaining weight when you are pregnant. You'll notice that your body is getting bigger, but you're not necessarily gaining fat, becoming unhealthy, or turning into a slob. So I think being aware of these changes just makes you that little bit more accepting that you're aware that it's obviously important for this gain so that your baby develops healthily. Throughout your pregnancy, you have the hormone relaxin going through your system, and these hormones remodel collagen to a more hydrated form. The relaxin affects all joint structures, so the ligaments are actually softening as the pregnancy progresses. And your joints are susceptible to trauma because they're not as reliant on the strength of the ligaments as they are pre-pregnancy. Here's a nice diagram that the system is releasing relaxin hormones throughout the gestation period of being pregnant, and as you can see it comes in surges, with most released at the early stage of 12 weeks and then it slowly tapers off. But these relaxin hormones are continuing to come and be released into the system until the baby is born. Posture. So as the pregnancy advances, obviously there are changes happening to your posture, more load on your spine. Your centre of gravity is moving forward as your tummy starts to grow. It's important, and try to ensure to tuck your tailbone and your pelvis under just to minimise the effects on your lower back so that there's less strain. Important to engage your core muscles with function, especially if you're moving, bending, twisting, lifting. Avoid prolonged positions, both sitting and standing, and try to avoid heavy lifting because of the nature of the extra stress on your lower back, whether you're pregnant or not. Pelvic floor. So pelvic floor is obviously an important group of muscles while you are pregnant. And 3.8 million Australians are incontinent. 70% are women. 1 in 3 women who have had a baby are incontinent. 50% over 50 will suffer a prolapse. And these were studies done early on, so they may have increased, especially with our awareness of pelvic floor, more research that's gone into the area. So these are good statistics to make you realise how important your pelvic floor muscles are. Just a quick overview of your pelvic floor anatomy. So the pelvic floor muscles sit at the base of the pelvis, from your pubic bone to your tailbone, and they're wrapping around all 3 passages, front, middle and back. The pelvic floor is a muscular sling that supports the bowel, uterus and bladder. As I said, it attaches from the pubic bone to the coccyx, and these muscles are stretched and weakened during pregnancy and vaginal delivery. Causes of weakness: the weight of the baby, the type of delivery, straining on these muscles while you are pregnant or even afterwards, and high impact exercise. Symptoms of pelvic floor weakness: leakage under stress, such as coughing, sneezing and sport, especially high impact sport. So all of these stress inducing activities bear down on our pelvic floor. Increased urgency and frequency, heaviness and dragging sensation, strenuous exercise such as heavy weights, high impact exercise like running, jumping, hopping, skipping. Now we tend to advise what not to do the best to protect your pelvic floor while you are pregnant. Avoiding intense abdominal core exercises, heavy resistance or weight training, deep squats and lunges because that will also put pressure on your pelvic floor, high impact activities and holding your breath. Pelvic floor exercises. So pelvic floor muscle training is really beneficial when you are pregnant. It should be done slowly and quickly because they're made up of fast and slow twitch muscle fibers. Each pelvic floor contraction should be done at a maximum effort. Find your pelvic floor. So everyone, let's have a find of our pelvic floor. Bring your fingers together, thumbs together and pointer fingers together. This is a rough size of your pelvic floor. It's a diamond shape where your pointer fingers are your pubic bone and your thumb joining together is your coccyx. The width of the pelvic floor is roughly the inside of the thumb muscles. Pinching between your thumb and your pointer finger is the thickness of your pelvic floor muscles. And if you squeeze your cheeks, that's roughly how much stretch those muscles have. So as you can see, it's quite a small muscle group, but obviously very important. So as I said, especially during pregnancy, even before and after, male, female, we should all be doing some pelvic floor exercises every day. So the rough dosage to strengthen these muscles with a maximal effort is squeeze and lift up your pelvic floor for 3 seconds. If you find 3 seconds really easy, try and hold for 5 seconds. Then relax the pelvic floor. So when you let the pelvic floor go, you're relaxing the muscles, and this is just as important as lifting the pelvic floor. This is 1 repetition. Gradually increase to 10 repetitions per set, and we're aiming for 3 sets a day. The endurance of keeping that muscle tone nice and strong is just 1 long hold, squeeze and lift as strong as you can and as long as you can. Again, with maximal effort, gradually progressing up to a minute. If you can hold for a minute, you're doing very well. Just a little fun quote for the day. Sometimes in workout class I pretend to work out when really I'm using every muscle in my body to keep from farting. So again, another benefit of keeping your pelvic floor nice and strong. There's a great pregnancy pelvic floor plan app which you can pop on your phone. Really good way to keep you motivated to do your pelvic floor exercises. Deep abdominals. So your deep abdominals are another important muscle group that make up your core. Very important during pregnancy as well, as they help stabilize your pelvis, minimize low back pain, and allow you to prevent abdominal separation or allowing that separation to get too big. So your deep abdominals, also known as transverse abdominis, are the 4th and deepest layer of your stomach muscles. So pop your hands on your hip bones and just move in slightly to that softer area. Imagine you have a belt on and you're trying to pull that belt to the last hole. So you're pulling that belt nice and tight and gently drawing in your lower abdominals. If you feel movement under your fingers, that's your transverse abdominis, or those deep abs that we're talking about. Can you feel them? Mm-hmm. Great. We should be able to breathe, talk, do our exercise, and have our deep abdominals switch on. Deep abdominals then brings us into a DRAM, a diastasis of rectus abdominis. So your rectus abdominis muscles are the first layer of your stomach muscles, and these muscles are getting stretched when the baby grows. Some women get a separation, some women don't, but it is very common, where rectus abdominis starts to pull apart and that connective tissue creates a gap between the abdominal muscles. It is the separation of the six-pack muscles, greater than 2 centimetres above and below the umbilicus on head lifting. So lifting the head, lying on your back, is a way that physiotherapists assess for a DRAM, and anything larger than 2 centimetres is considered a separation. As I said, very common, occurs in 66% of women during the 3rd trimester. Some causes for abdominal separation or a DRAM is close pregnancy, so not allowing that separation to close before having 2nd, 3rd, 4th and multiple babies. Lack of recovery of the abdominal muscles, so the rehab after you've had your baby allows those abdominal muscles to close. Having a large baby or twins. Overuse of abdominals against resistance during pregnancy. So coming back to those recommendations at the beginning, such as heavy weight training, naturally does put a lot of stress on our abdominal muscles. And genetic predisposition can sometimes also lead to an abdominal separation. As well, the hormonal changes that are happening to your body during pregnancy with the relaxin release and progesterone can also allow that separation to occur. The effects of having an abdominal separation or a DRAM. It can lead to back and pelvic pain. Essentially, you're losing a bit of support through your abdominal wall, so your lower back especially is having to work a lot harder to stabilise you, and can lead to achiness and more strain on the lower back. Pelvic girdle pain. Umbilical hernias are quite common if women's abdominal separation doesn't close, again because of this gap around the belly button can increase the risk of getting a hernia. Pelvic floor dysfunction and the cosmetic effects of having that gap sometimes can, I guess, disappoint or allow women to worry about it because it doesn't look so good. So some precautions. Heavy ab work, as we've mentioned, such as sit-ups, crunches. The build-up of intra-abdominal pressure. So when we flex our spine and curl up like a sit-up or crunch, we are increasing the intra-abdominal pressure. Heavy lifting as well is not advisable. Pulling or pushing, especially again heavy weights. Sit-ups, that same motion as an abdominal crunch, which also leads to the increased abdominal pressure, is actually pushing your abdominal wall out. So if you do have a DRAM, or if you see women that do have abdominal separation, there are ways that we can manage it. And this white piece of fabric on this lady's abdomen is called a tubigrip, and it's a really great piece of compression bandage that can prevent abdominal separation from getting too big, or in the early stages prevent it from happening at all. It's a nice amount of compression that it's not at risk to the baby, and it's also not so tight that it's causing your muscles to switch off. Definitely recommended. Get advice from your physio, and as physios we prescribe them to our pregnant women as a great garment that's safe to wear for the whole pregnancy. Pregnancy-related pelvic girdle pain. So as physios we see this quite a lot in the clinic, and a very common area that pain can occur as a result of the changes that are happening to your body when you're pregnant. 80% of pregnant women suffer some degree of back or pelvic pain, mainly through the sacroiliac joints and between the pubic bone, which is the pubic symphysis. Best to do things to minimise the risk. And these implications, so stuff that can lead to pelvic girdle pain, stationary standing, wide stance or walking with a really wide stride length, walking a lot, up and down stairs, rotation through the pelvis, single leg weight bearing, high impact exercise and sudden jolting or jerking movements. Replacing with narrow base, even weight bearing options. So we like to say, imagine you're wearing a mini skirt. It's nice and short and tight, so you don't want to take big steps, and keeping everything within those closed constraints of the size and width of your hips. Keeping your core and pelvic floor strong can also help minimise pelvic girdle pain. So lots of pregnancy safe exercises. We're very encouraging of keeping active during your pregnancy, providing that you are doing safe exercises that's not going to put your baby at risk or put your pelvis, low back or any other joints under stress. Goals of exercise in the childbearing years. So you're really not going to start training for a marathon while you're pregnant. It's all about keeping your health and fitness at a level that's easy to maintain so that your pregnancy is enjoyable without increasing the risk of getting any aches or pains. Assisting with your physical and psychological health. So we all know that whether you're pregnant or not, exercise is really important for our mental health. And definitely with all the hormonal changes, the emotions that come with being pregnant, keeping active and doing some exercise has huge benefits on the psychological well-being. Assisting in preparation for labour and postnatal recovery. So we know there are lots of studies that have been done that pelvic floor strength can really prepare you for a great labour and also improve the recovery after the birth. Also, keeping strong will allow you to have a nice postnatal recovery and again minimise the risk of aches and pains after you've had your baby. Assisting in prevention of physical complications such as pelvic pain and low back pain. So again, coming back to the pelvic floor and core muscles, keeping your spine nice and strong, pelvis nice and stable, then this is going to help as well. Education, so we spend a lot of our days, physios, is educating our pregnant women, and it just gives everyone the confidence and the reassurance that having that knowledge about safe exercise while you're pregnant will allow you to again enjoy your pregnancy. The social interaction and support, so being able to keep active, do some fitness classes, exercise with women that are going through similar experiences, provides that nice interaction and support for everyone that may have a story to tell or questions to ask because everyone's going through similar experiences. How much exercise? So the frequency of how often to do your exercise, again, as I said, we are encouraging, as long as you're doing it safely, that you can exercise on most days of the week. Important as well to give yourself a rest day, but maybe 4 or 5 times is a good balance. The intensity, so you're obviously not exercising to an intensity that you would if you weren't pregnant. And we have this rating of perceived exertion scale on the right-hand side. So we're roughly aiming for around 13 to 14, so somewhat hard. You don't want to be getting too short of breath as you do your exercise, especially if you're engaging in cardio such as walking, bike riding, because the heart rate's already working a lot harder, so we don't want to put you and your baby under too much stress. The talk test is a nice easy way to monitor that your heart rate's not getting too high. So whenever you're engaging in any exercise, you should be able to talk but not sing. If you can't get those words in, your heart rate's pumping a little bit too high and you're probably pushing yourself that little bit too much. Roughly around 30 to 40 minutes of exercise is a nice safe amount. Again, fatigue, obviously core temperature is increasing when you're pregnant, so you find you might get a bit hotter quicker, so not overdoing it with the length of time is also important. Working our large muscles, continuous movement, because our blood pressure can change, we don't want, again, lightheaded and dizziness, keeping to low impact exercise, and a good endurance gym program where you're also using light weights. Training by semester. So pregnancy is broken up into 3 semesters, 1, 2 and 3 trimesters, sorry. 1 to 12 weeks is the first, 13 to 27 and 28 to 40. So each of these trimesters is bringing about different changes in the body, most obvious being the size of the baby developing, size of the tummy. First trimester, so the mum, the newly pregnant woman might be experiencing some fatigue because of the hormonal changes, constant nausea, also known as morning sickness, the emotional changes, and really noticing an increase in the number of times that they have to go to the bathroom. With the baby, the changes in the fetal temperature, the heart rate, so even the mums as well might notice that they start to get a bit short of breath. The oxygenation levels are changing. 3 to 8 weeks in that first trimester is when mums are at their greatest risk of miscarriage, and that's why a lot of the time it's advised to take it pretty easy. Heat perception is unreliable because your core temperatures are changing. Finding that as well with the frequent urination, that the hydration is important, so getting more thirsty easily, and that, as I mentioned, that your core temperature is increasing. Second trimester, so we tend to advise after 16 weeks no exercise lying on your back, because when you are lying on your back exercising, your major blood vessels are pushed up, so you can get quite lightheaded, short of breath and dizzy. As well, motionless standing should be limited. So we're doing exercise without moving our legs or just standing still. Again, those changes in the blood pooling can cause some adverse reactions such as fainting, which we want to avoid. And avoiding exercising at high altitude. Again, changes with your hormones, your postural changes as you start to notice that the stomach size is getting bigger, more weight on the pelvic floor, abdominal muscles are starting to stretch, and because of the release of the relaxin hormones, changes in the joints as well. The last trimester, again, the posture and gait changes continuing to occur. And as we tend to notice, heavily pregnant women having a bit of a waddle when they walk is a change that's happening to their gait or walking pattern. Towards the end, the baby starts to engage or drop in the pelvis, so there's more weight on the pelvis. The rib cage expands, the uterus is enlarged, and again, frequent urination. Again, because of the size of the baby, the mums find that they're even more short of breath, a bit of reflux because of the baby pushing up as well, cramps, and the beginning of Braxton Hicks contractions. Pilates is a nice, safe, gentle, low-impact form of exercise during pregnancy and also has great benefits for afterwards. So at BeActive, we treat a lot of conditions, and physiotherapy is beneficial for pregnant women if they need it. Pelvic floor, pelvic and back pain, carpal tunnel syndrome in the wrists is quite common. Exercise. So prenatal fitness classes supervised by a physiotherapist is a great safe environment to exercise in when you're pregnant, and clinical Pilates. Just a quick touch on postnatal care. Because afterwards, especially those first few weeks, a lot of mums aren't quite sure whether they should be exercising or what they should be doing. And it's really important those first 6 weeks that you are taking it quite easy. In the hospital, again, lots of excitement, caring for your newborn, maybe some sleepless nights. So really just starting with some pelvic floor exercises is all you need to do. Rest is very important in those first few weeks. You may need to ice, wearing compression and elevation. So still allowing that time for you to give your body a rest, making sure you're lying down, feet elevated if you're finding that you're still a bit swollen after having your baby. And working your deep abdominal muscles. So not too much exercise training in those first few days especially, but just being aware of your core muscles. Everything will feel a bit different as they've been stretched for the last 9 months, but starting to just be mindful of where your deep abdominals are, using them if you're bending, twisting, just to support your lower back. When you get home, again, keeping with those recommendations for the first few days while you're in hospital, and still allowing yourself to have some time for rest. So 2 hours of horizontal time is important on top of the hours that you're getting when you're sleeping. Your pelvic floor and deep abdominal muscles still should come first. So avoiding any straining, again, heavy lifting, really doing those activities like you were when you were pregnant. Just starting with some short walks, again, balance with the rest. And really using your, the weight of your baby as a guide for how heavy you should be lifting in those first 6 months. Recovery garments are also an option, which I'll talk about later, that are also a very beneficial way to assist in your recovery. Getting back into shape. So as physios, we tend to recommend a check at 3 to 6 weeks after you've had your baby. Again, slowly introducing low impact, gentle exercise after 6 weeks as guided by a physio. Still, your core and pelvic floor muscles must come first. Swimming is safe to do so after 6 weeks, but just providing you've had your 6-week checkup with your obstetrician. And can you do high impact exercise? Again, this is debatable, but we tend to recommend wait until you're 12 weeks postnatal, come back for your physio check, have the real-time ultrasound where we can see your core and pelvic floor, and we can give you a bit more guidance as to when you're possibly safe to get back into high impact exercise. And again, a carefully tailored program or class is important, especially in the first few months after having your baby. All right, thank you for your time. And if you have any questions, don't hesitate to ask. Thank you.